The importance of sharing good practices is not lost on healthcare professionals. Think about a publication on a medical journal. What is it if not an attempt to share knowledge, in the hope that it will contribute to the collective understanding of a certain condition or the mastering of a certain technique? In the Lean world, there is a term for knowledge sharing, yokotan, an abbreviation of the Japanese word yokotenkai. Yokotan has worked wonders for Lean healthcare in different parts of the world, where, over time, the Lean experiments of one hospital have ended up inspiring many other organizations to also give Lean a try. One such place is São José dos Campos, around 100 kilometers from São Paulo, Brazil, where in the last few years the work of IOV, the cancer clinic we talked about in episode 1, has triggered something of a Lean revolution. The first organization to get interested in IOV's Lean transformation was the 372-bed Hospital Municipal Dr. José de Carvalho Florence. Being the largest public hospital in the city of 650,000, this is a very busy place, with 700 daily patients, around 21,000 each month, and all the specialties that a hospital serving a large city needs to have, from neonatal care to a trauma center. The hospital's greatest challenge back then was demand, which was far greater than capacity. At the time, corridors were full of patients and waiting times were very long, and this is what eventually led the organization to look into Lean thinking. With the help of IOV and Lean Institute Brasil, the Hospital Municipal took its first steps towards a Lean transformation, learning to map the value stream and to control the lines.
Começamos no pronto-socorro mesmo e nós fizemos então um grande A3 estratégico para a instituição, que é o A3 de gestão do acesso. Era o nosso maior problema, então esse A3 a gente focou muito as altas nas enfermarias para ter um giro maior de leitos e focamos muito o tempo de espera no atendimento da porta do pronto-socorro mesmo.
The ER team made its measurements and realized that 25 was the number of patients they could deal with without compromising quality or getting into crisis mode. So they made that their standard and identified 3 different levels of severity in the ER's capacity usage in the event of the number going beyond 25, detailing how everyone's responsibilities and the resources deployed would change in each of the scenarios. The idea behind this was to always have a plan to go back to the standard.
Nós tivemos excelentes resultados, aumentamos muito nosso giro de leito aqui em aproximadamente 4 vezes. E também o tempo lá no pronto atendimento diminuiu em 64% o tempo de espera lá no pronto atendimento, para espera médica. Hoje a gente saiu de 2015, que eram 14 horas de tempo de desfecho, para 3 horas e 15 minutos.
Such impressive results didn't go unnoticed, and before long, other areas in the hospital came knocking on the ER's door.
Uma coisa que muito legal é que começou pelo pronto-socorro, os resultados foram positivos, e com o tempo as outras áreas foram solicitando, eu não posso ir lá no pronto-socorro ver o que está acontecendo e tentar colocar e adaptar para a minha área, né? E aí veio os setores de apoio, então a gente começou a trabalhar com a farmácia, com o tempo o laboratório, a gente também tem um problema aqui, será que com alguma parte do Lean aí a gente também não consegue? Então vamos lá também. E isso foi tomando uma proporção que chegou, né, assim, para todo mundo. Isso facilitou muito, com certeza, para a gente, para que todo o processo, toda a jornada seguisse.
Today, much of the hospital is leaned out. Standardized work in A3s are everywhere, and daily huddles have become the go-to way to stay on top of the daily work. Yokotan is happened internally at the Hospital Municipal, helping Lean thinking to spread across departments like wildfire. That's why it is common to see the same practices adopted in and adapted to other areas, like neonatal care. Here, for example, the daily huddles, which are the key enabler of a daily management system, were introduced after the emergency room introduced them, with the necessary changes. Another organization that caught the Lean bug from IOV was the Campos de São José Primary Care Unit. In 2021, nearly 90% of their appointments were scheduled, and patients showing up hoping to see a doctor actually had to wait between 30 and 45 days for an appointment. When the day of the appointment finally came, many of them forgot about it, or simply didn't show up because they had already received help elsewhere. Wanting to give their patients quicker access to care, the unit initiated its Lean turnaround in 2021, studying its current situation and introducing daily management and A-free thinking as the key tools to standardize and share information and to solve problems. The improvement work carried out at the unit focused on rationalizing the lines and on creating dedicated pathways. Before Lean was introduced, every patient joined the same line, independently of what they had to do. Not all of them had to see a doctor, however, and it turned out that nurses could actually help a lot of them, for example those in need of a prescription refill. The frontline team led the transformation of the flow, and the many improvement suggestions came from them.
Como que a gente conseguiu essa mudança? Trabalhando primeiro eles traziam a proposta, eles traziam o problema. Então, quando a gente começou as primeiras reuniões, a gente fez questão de convidar todos, desde médico, enfermeiro, auxiliar de enfermagem, agente comunitário de saúde, recepcionista, pessoal da odonto para participar da reunião. E eles aderiram por quê? Porque eles ajudaram a construir. Eles faziam o Gemba junto, cada um fazia o Gemba de uma área. Foi importantíssimo porque eles saíram das caixinhas. Os agentes comunitários começaram a perceber como era difícil ficar na farmácia, o pessoal da farmácia como era difícil ficar na porta, então eles começaram a olhar o BS como um todo.
Eu tenho 10 anos aqui, eu sinceramente nunca tinha visto algo dessa natureza aqui. Sempre os problemas eram gerados na unidade, né? Mas as soluções vinham de cima, de quem nunca sequer esteve aqui para resolvê-los. Então, quando o projeto vem com essa proposta, é extremamente motivador para nós, os funcionários, né, a parte operativa, porque, de fato, quem tem as verdadeiras soluções dos problemas é a parte operativa. E quando você apresenta as ferramentas, né, necessárias para se fazer isso da maneira mais segura, mais econômica, mais viável, padronizada, então o projeto nos trouxe benefício enorme na operação.
Other changes to the flow included the introduction of a so-called totem at the unit's entrance, helping to guide the patient by asking them what they came in for and telling them how long the wait would be. For hypertension and diabetes patients, a dedicated pathway was created, where appointments for prescription refills and doctor consultations are scheduled at specific times of the week. All these actions eased the pressure on the primary care units significantly, and the average waiting time went down from 54 to 35 minutes. The unit's pharmacy switched to a weekly supply process, and that allowed them to clear up an entire room and reduce by half the area they operate in. When the team discovered that, despite the work taking place in such a tiny room, to go get certain drugs the pharmacist had to walk up to 2 kilometers per month, they changed the layout and moved the drugs that are most frequently used to the front for easier access. Thanks to its lean work, the campus de São José unit is now able to see 60% of walk-ins on the same day. They're now hoping to become something of a model line, an example that can be exported to other primary care units in the city. This wouldn't be the first citywide Lean initiative. A year and a half after the Hospital Municipal began to work with Lean, the São José dos Campos healthcare system got interested in the approach too.
E desde então a gente vem trabalhando com eles desde final de 2018 a 2019 para montar o que o sistema de saúde chama de projeto Previna, que agora é um programa Previna, que administra todas as organizações que estão envolvidas no cuidado do câncer do nosso município para garantir acesso rápido ao cuidado e cuidado adequado para esses pacientes. Então, hoje um paciente com câncer que precise procurar um oncologista aqui na cidade, ele consegue fazer isso essa semana. O que muda radicalmente o impacto do câncer na vida das pessoas. Assim, isso muda muito você ter acesso rápido ao cuidado, isso muda o prognóstico, isso muda a expectativa de vida.
For IOV, the involvement in other organizations' improvement projects and transformations stem from the realization that to have a real impact and truly reduce the burden of cancer, they would need to team up with the rest of the healthcare system they are a part of. The Provina project doubled access to cancer care in São José dos Campos and more than halved the time between diagnosis and treatment for 80% of patients. This has, without a doubt, saved countless lives in the city. Throughout its journey, IOV has been supported by Lean Institute Brasil, whose mission is to spread lean thinking and practice around the country. While recognizing a lot still needs to be done before Lean becomes a national phenomenon, Institute Director Flávio Battaglia comments on the role that IOV is playing in Brazilian healthcare.
Isso só tem sido possível porque a gente encontrou especificamente no Brasil uma ilha de excelência, um lugar onde essas ideias foram aplicadas num nível de profundidade inédito, que é o IOV. Então, assim, eu arrisco dizer que o que a gente conseguiu fazer até agora no Lean na saúde no Brasil, em grande parte deveu-se ao fato de a gente ter encontrado algumas pessoas que aplicaram essas ideias, aperfeiçoaram isso. E mais do que isso, são pioneiros no sentido de abrirem as portas para que outros pudessem ver. Então, hoje o IOV é um centro de excelência que recebe visitantes não só de organizações da área da saúde, como de outros setores.